everyone. My name is Chelsea, and
And I'm Miles Gibson, and today we'll be talking to you about CBD.
all right. So, what is CBD? CBD, or cannabidiol, is a chemical in the cannabis sativa plant, and it's also known as cannabis or hemp. And so, what they do is they obtain the CBD from the hemp, which is a form that only contains a small amount of THC, and it is essentially a cousin of the THC, which means that CBD cannot and will not get you high. It is possibly safe when used orally and appropriately, but you should always talk to your doctor or your provider first before taking any form of CBD.
So, is CBD legal? Federally, CBD is legal, but it has its own laws. The state has its own laws to govern CBD. So, on December 20th, 2018, President Trump signed the Agricultural Improvement Act of 2018, also known as the Farm Bill, and this was enacted under Title 10. The Farm Bill made the cultivation of hemp federally legal for the recreational purposes of hemp. This bill removed cannabis containing less than 0.3% THC, CBD, which is CBD, from Schedule 1 list of controlled substances. So what about CBD in North Carolina? In North Carolina, hemp byproducts, CBD also, has been reclassified as agricultural products separated from marijuana. So CBD and marijuana are two separate things now in North Carolina. The state of North Carolina introduced the Senate Bill 313 in 2015 and later modified it in 2016 in the House Bill of 992. So what did this do? This established the North Carolina Industrial Hemp Pilot Program, where NC became accepting applications for hemp farmers to cultivate hemp for the first time in decades. In 2016, this created over a $170 million industry, and by the end of 2021 last year, it was over $1 billion industry. In North Carolina, there are no possession limits, so you can't get in trouble for having too much CBD on you as long as the products follow NC production laws and hemp requirements. So those requirements are containing less than 0.3% THC.
So, is it effective? So, the main studies that have occurred have primarily been for the pharmaceutical medication or the prescription drug Epidiolex, and that is only by prescription, and it was approved by the US FDA for seizures, and it's unclear if other forms of CBD are helpful for seizures. However, there's been a rise in the number of other purposes that CBD has been used for, so things like chronic pain management, lowering anxiety, improving sleep, inflammation, but there isn't enough reliable information currently published to infer and support these claims.
So, is it safe? There has been some side effects seen orally with the use of CBD. There has been some cardiovascular side effects, some skin reactions, which is pretty rare. One of the big ones is dry mouth, diarrhea, vomiting. We have seen appetite decrease, weight loss, also sometimes weight gain. We've seen some sedation, dizziness, agitation, and also there is an increased chance of pneumonia. But most commonly, we most times see diarrhea, liver problems, nausea, cotton mouth, drowsiness, and the interference with other medications.
So what kind of products exist? There's a variety of different products that we see on the market. So we see oils, tinctures, which is an alcohol-based extract. There's topical creams or waxes. There's capsules. There's CBD gummies. And there's also Delta 8 THC products. And there are prescription medications, such as a synthetically made prescription medication called trinabinol. And there's also Epidiolex, which is a specific form of CBD that the FDA approved for in the US for seizures.
So how do I know that the CBD that I'm purchasing is reputable? So CBD products are required to have QR codes. So what does this QR code contain? This QR code contains information on how it's grown, where it's from, the amount of THC oil in the product, and again, products should contain no more than 0.3% THC. It also will contain information about lab testing for authenticity, spectrum, full spectrum. So when we're talking about spectrums, you have full spectrum. So that's small amounts of THC. So that could be less than the 0.3% of THC. And then you have broad spectrum that do not contain THC but have other components of the cannabis plant.
So what other medications do you need to look at interacting with the CBD? Just to make sure we are providing a list. So it's also important to know that this is not an all-inclusive list. So you should definitely talk to your pharmacist or your healthcare provider prior to starting CBD. A few of the big ones that it interacts with are Briviact, caffeine, there is Tegretol, citalopram, as well as lithium or methadone and other sedative medications. And then other medications such as warfarin are another big one that we want to make sure we look out for, and even losartan and topiramate.
So, are there any foods to avoid? CBD can be taken with or without foods, but it is important to note that fatty foods or drinks such as milk and alcohol increases the concentration and absorption of CBD in the body. There were several studies that looked at this, and I think Minnesota University took on this, and they found that this was actually true. Grapefruit juice is another component that we should watch out for, and I'm pretty sure that your doctor has warned you about this with other medications. But what grapefruit juice does in cohorts to CBD is both grapefruit juice and CBD bind to similar enzymes in the body. The enzymes that we're talking about are important and responsible for breaking down drugs properly in the body. So the consumption of both CBD and grapefruit juice may lead to harmful levels of CBD in the blood.
So whenever you're using CBD, it is usually used in doses of 200 milligrams or less per day. And that's whether it's oil, food, beverage. They can also be administered orally by simply eating or drinking the product. And there's also sublingual, which means that it goes directly under the tongue, and then that diffuses under your tongue and you absorb it that way, and it goes directly into your bloodstream. And then the topical products or the creams or lotions and balms, those are applied directly to your skin.
So what is the future looking like for cannabis or CBD? There's a new prescription called Sativex. It's not currently approved in the United States at this time, but it is approved in Europe. It's derived from delta-9 tetrahydrocannabinol, that's THC. It's used in patients with moderate to severe muscle spasms due to multiple sclerosis. Clinical trials have shown that Sativex has a positive impact on muscle spasms while alleviating associated symptoms, including pain, bladder, or sleep disturbances. So we are seeing a positive future for cannabis and CBD in the United States, as we are starting to see THC in neighboring states such as Virginia, also in Washington, D.C., and a long list of other states that are starting to approve cannabis for recreational use and also medicinal use. So that sums up our presentation on cannabis use or CBD use. Feel free to reach out to us with any questions that we can possibly answer for you, or if you have any possible questions that just pertain to you and your medications, feel free to ask us or contact Dr. Baldwin or call Resources for Seniors. Thank you.